Welcome back. Thanks for staying with us. The Democratic Alliance in Gauteng is calling for urgent improvement in the public health system. It comes after reports that the provincial department paid out 228 million rand in medical negligence claims. To discuss this further, I'm joined by Jack Bloom, Gauteng DA spokesperson on health. A very good afternoon to you. Thank you for your time. Does this figure come as a surprise, especially looking at some of the horror stories we continue to hear about the Gauteng health system?
Unfortunately not, because it just seems to go from bad to worse. In fact, the negligence claims seem to be going up. What's even worse about these 228 million rand payments is that they had to be forced out of the department. The sheriff of the court had to attach the bank accounts of the department 78 times. So there were probably more payments that they did pay in time, but these ones they had to be forced to pay. And some of these payments date back to 2013. I mean, we're paying for the sins of the past. The problem is more and more cases keep coming in, and it's going to become unsustainable because this comes out of the normal health budget. In fact, the total claims is probably now approaching 20 billion rand. I mean, that's an incredible amount of negligence claim. They might not have to pay that amount in reality when the court makes an award, but still, it just shows you that things are still terribly wrong. I'm just terribly disappointed that the negligence claims seem to be going up instead of going down.
And that's a massive concern. I mean, you speak about the time factor, paying for the sins of the past. One can imagine the impact that would have on the individuals affected.
Well, absolutely. You know, a large percentage of these claims, the high-paying ones, are for babies damaged at birth. They get cerebral palsy from brain damage, and, it's a lifelong disability. It's extremely tragic. In fact, money can't be proper recompense, but, these poor children are going to need lifelong care. It's obviously terrible for their parents and very stressful, and there are large payouts. Sometimes they've had to pay out as much as 30 million rand. But obviously we should be having decent medical care in the first place so that patients don't get damaged, that we don't have brain-damaged babies, that people don't have the wrong leg amputated. I've seen the most terrible claims. You just wonder how this could absolutely happen, but those are real-life cases. People are damaged at hospitals. They go there to be cured, and they come out worse than they went in. And obviously, one feels for the patients, and if they have a valid claim, it needs to be paid. But this all comes out of the present health budget, and they need to fix up the hospitals as soon as possible so that we minimize the claims and all patients get decent health care.
Yeah, and just about a month ago or so, we got some form of a reality check when it comes to the real impact inside some of the Gauteng hospitals, with pediatrician Dr. Tim de Meyer writing an open letter to the Gauteng Health Department saying that the horrendous conditions in the public hospitals contribute to children's deaths.
Well, absolutely. It was a cry for help. And what did the top department do? Instead of listening to him, they wanted to suspend him. They did suspend him. There was an outcry, and unfortunately, there was an outcry. Unfortunately, his suspension was lifted. But then they tried to do further disciplinary moves against him. Look, I think people like Dr. Tim de Meyer are heroes. And should be praised for speaking out. He did try to go through the correct channels, and they weren't listening to him. Now, he works for a hospital where, have mothers and children, the most vulnerable people in our country, and they're not getting decent care. And he said children are dying. Mothers are dying because we don't have proper equipment and staffing, and, things are not what they should be. It's a cry for help that I hope is heeded. But let's get to the root of the problem. I think it's just persistent bad management, incompetence and unfortunately massive corruption in the Gauteng Health Department. Let's take the CEO of the Rahima Musa Hospital where Dr. Tim de Meyer works. I mean, she should never be there. I mean, how did she get appointed in the first place? She should be attending to the problems that Dr. de Meyer identified instead of suspending him. So until we get proper leadership at every level in the Gauteng Health Department, right from clinics to hospitals to head office, to infrastructure, because there's another problem. They can't seem to maintain our hospitals and fix equipment. Until we get that right, unfortunately, we're going to get more and more medical negligence claims, and just think of the suffering behind this and the huge payouts that have to be made.
So with the claims getting higher and higher, then that must mean that, there's little money, little budget to fix the root problems that you make mention of. I mean, it seems no end in sight.
Well, the budget of the Gauteng Health Department is close to 60 billion rand. I mean, that's about the same size as the entire budget for the city of Cape Town. And I really think if we got rid of the wastage, corruption, incompetence, and everything that's gone wrong with that department, we could do so much better in running our hospitals. So I really think that the management issues need to be tackled. We must boot out all these corrupt people. We really have to put the best people in charge of hospitals and clinics and get things right. And listen to the doctors. The doctors have made sensible proposals. They offered to be part of the solution. If we can get that right, I think with the existing budget we could do far more, and we'd have far fewer medical negligence claims, which are just absolutely tragic. Our hospitals should be places of healing where people get better, not where they suffer damage because of avoidable reasons.
So what role can the National Health Minister play?
Well, we talk about the Gauteng Health Department. I hate to say it's even worse in other provinces, the rural provinces especially. I mean, Eastern Cape, the medical negligence claims are more than the total health budget there. But I think they need to follow the Western Cape Health Department, which has far fewer medical negligence claims. They actually get a clean audit every year from the Auditor General, and we should be following what the Auditor General says. Every year he gives a terrible report on the Gauteng Health Department, but he does tell them what they can do to fix it. And I think we should look at the Western Cape Health Department as an example, and the National Health Department should be pushing this as well. Instead, we have this completely unrealistic plan for a national health insurance system, which, if they don't fix up the public health system first, they're going to ruin the entire health system, and doctors are going to flee the country because, nobody wants an incompetent government taking over the entire health system.
Yeah, very well. Thank you so much for your time. Thanks for weighing in on this. Jack Bloom, DA Health Shadow MEC, speaking to 228 million rand paid by the Gauteng Health Department in medical negligence claims.